This week I talk about culture care theory. Culture care theory, I'm going to talk about the identification of theory, issues or concerns in selected area of advanced practice nursing, and theory as a framework or for evidence-based practice, and conclusion. I'm going to talk about the identification of culture care theory, background, the 8 dimensions, and 3 systems of caring. Legendre's theory of culture, care, diversity, and universality is said to be the product of more than 60 years of research and continual development, during which she and others studied over 60 cultures and identified at least 172 care constructs for use by nursing and other healthcare providers. When it comes to Legendre's theory, has 8 cultural and social structures dimensions that include technological factors, spiritual, religious, philosophical factors, kinship, and social factors, culture, values, beliefs, and life ways, biological factors, political and legal factors, economic factors, and educational factors. There are 3 systems of caring that Legendre includes in her practice are generic folk care, integrative care practices, and professional care practices. Generic folk care is defined as a culture-derived practice that is important for growth, health, and survival of humans. Professional care practices is defined as cognitively learned practice therapeutic that is learned through educational, such as schools of nursing and medicine. Lastly, integrative care practice is defined as a combination of folk care and professional care practices in use together. Identification of culture care theory. How culture care theory includes and coincides with family nurse practitioner. Madeline Legendre's theory focuses on the deep and clear understanding of the individual, family, and community for a unique and cultural perspective, with nurse practitioners should not be judging the patient on their cultures or beliefs. As a nurse practitioner, we may encounter patients who have different beliefs than us. As a provider, we need to push away our own beliefs and really focus on the patient and what they believe in. When a provider does not know a certain culture, they have a little knowledge. It's essential as a provider to include these patients' cultures or beliefs into their care plan. We want to be able to have our patients trust us so they can receive the proper care that they need. By judging a patient for their culture or beliefs may end up with the patient not trusting you and may not follow the care plan that was designed to treat them. As healthcare providers, we want to make sure that the patient gets the best quality care and have the best possible outcome. Issues or concerns in family nurse practitioner. Providers versus patient's culture and or beliefs, learning to accept different cultures and or beliefs. Madeline Legendre's theory was meant to culturally congruent nursing care practices. As a family nurse practitioner, we are going to care for patients that come from different cultures and or beliefs. We may not agree with the patient when it comes to their culture and beliefs, but we need to put our own feelings aside and listen to what the patient has to say. Oftentimes, I find that healthcare workers and providers are quick to judge someone due to their culture. This is when the healthcare provider, we should be learning about different cultures and how to utilize them to our practice. It is already frightening for the patient to learn a new culture when coming to the United States. I think it's essential that we make our patients feel comfortable while receiving their care. This is when the provider should sit down and talk with the patient and come up with a care plan together that incorporates the patient's culture and beliefs. As the end of the day is about working together as a team to give the patient the best possible outcome. Theory as a framework for evidence-based practice. According to the Journal of Transcultural Nursing, it is said that the reason for culture care practice is to help researchers and clinicians discover, document, know, and explain the interdependence of care and culture phenomena, while noting the difference and similarities among culture. The theory is to help nurses find new meanings, patterns, expressions, and practices related to the culture and care and practices related to the culture care that have influenced the health and well-being of individuals and families. Culture care theory is a framework for evidence-based practice. Evidence-based practice can be used to determine how well the healthcare providers know how to care for a patient of a different culture and belief. This can be done by doing a questionnaire or an educational module that has a quiz in the beginning of the module and then the end to see how much the individual has learned. It is essential that healthcare providers are equipped to caring for patients for a different culture. It is important to remind providers to put their differences aside and focus on the patient. Patients and providers should be working together as a team to give the patient the best possible outcome and the quality of life. We want to make sure that the patient that we care for trusts us. According to the Journal of Cultural Diversity, Literature advocated prioritize formal, informal, and ongoing transcultural education to develop culture holding knowledge, skills, and values necessary to achieve cultural congruence and mutually beneficial outcomes in diverse settings and situations for all the individuals. In particular, she noted the ethical and legal implications of education at health care professionals and students in their culture care to effectively reduce disparities in healthcare disparities. In conclusion, literature's theory of culture care is to help healthcare providers understand how to care for patients that come from a different culture. The culture care theory is a way for providers to become more educated on the care of patients and other families. It's essential that we do not discriminate someone because of their culture or beliefs. There should be a mandatory education for all healthcare professionals to complete once a year to reinforce about caring for a patient with different cultures and beliefs. As a healthcare provider, I want to make sure that my patient trusts me enough to care for them. If I care for a patient that I'm not familiar with the culture, I'll take time to talk to my patient or possibly look up information on the culture or belief. It's already hard for the patients to come to a new country to learn the new culture. This is why I think it's essential to incorporate part of their culture or beliefs into their care the way they have a little something of their home. Thank you for listening and taking your time. Have a great day.